Welcome to the WRAL Daily Download. I'm Grace Holland. After holiday gatherings, some of us might find ourselves bringing something more than just gifts home. Maybe a sniffle, a cough, or even a fever. It's respiratory virus season, and for the first time since the COVID-19 pandemic, we're seeing more people being treated for flu than coronavirus. Joining us to talk about this today is WRAL health reporter Grace Hayba. Grace, thanks for being with us.
Thanks so much for having me.
So let's start with the flu here. What did flu hospitalization numbers look like in December?
Well, coming out of Thanksgiving into early December, our area was really reporting more RSV and COVID cases, which was pretty typical from in the past. But now, in the past few weeks especially, we've really seen flu overtake both of them. RSV now pretty much holding steady, if not dropping. But yeah, flu's really taken the lead here with hundreds of positive tests a week and dozens more hospitalizations. And that's something we're seeing across all of our major hospital systems here in the Triangle.
How does that compare with COVID cases that we're seeing now?
Yeah, so just in the past week, or 2 weeks rather, for example, Duke Health alone more than doubled its flu cases, reporting a 112% increase in hospitalizations from the flu, so far outpacing its current COVID numbers.
How does, in general, what we're seeing with all these different respiratory viruses this year compared to what we saw last season?
So last year around this time, COVID was a little over 2,700 new cases, definitely in the lead of the three main respiratory viruses. Now, though, the most recent data is showing us that we're starting this new year with just under 1,400 new COVID cases. So about a 1,300 case difference there. And obviously, those are the hospitalizations, not just the new tests, but definitely shows that flu now is the bigger topic and talker in the hospital systems, and that's what's really overwhelming the hospital systems this time of year compared to last.
Gotcha. And so as we're moving into this, what precautions have hospitals in our area taken?
Visitors at all Wake Med Hospital patient care areas, which does include the waiting rooms, they all now have to be at least 12 years old, and you obviously can't have any COVID or flu-like symptoms, anything like that. Similar restrictions also went into place at UNC's hospitals, Chapel Hill, Hillsborough, and youth behavioral health campuses. Visitors there had to be over 12 as well. Anyone 11 and younger were prohibited from all inpatient areas and waiting rooms as well. Again, both hospitals recommending masking for staff and patients as well as visitors. And then Duke University Health System is rolling out its new restrictions and limiting visitors to two visitors at a time per patient. And then the children under 12 are not permitted to visit hospitals or wards without prior approval from healthcare providers and, of course, special circumstances. But again, all three major systems rolling out these changes, again, because we're seeing those numbers continue to rise, and I think it's likely that that's going to continue to happen.
All right. Well, let's stop there and take a break, and we'll be right back. Welcome back. Who are the patients doctors are seeing getting sick right now? Do we see a particular age group that's being affected?
Dr. Cameron Wolf, I spoke with him last week and this week as well. He's an infectious disease specialist with Duke Health. And he says right now the hospitals are really seeing flu specifically target the typical groups, which is a good thing. You know, those who you expect to get sick first. It's the younger patients whose immune systems haven't really been built up yet, your older patients whose immune systems have kind of weakened over time, and then those with pre-existing health conditions that are just more prone to getting sick. So that's really who we're seeing get sick right now. But again, while it is what you would expect, you obviously don't want that to continue because then it just continues to spread to everyone.
Right. And what are doctors expecting in terms of spread once this holiday data, post-holiday data really comes in?
Yeah, so unfortunately, Dr. Wolf said he still is expecting hospitals to be really busy over these next couple weeks. And that's just because it typically takes for all three of these, COVID, flu, and RSV, at least a couple days for someone to start to feel sick. And then after that, they have to feel sick enough to go seek treatment at a hospital, and in that time, they could be spreading it to their loved ones and their family members. And that's kind of what he expects to have happen, especially in the wake of New Year's Eve, Christmas parties, things like that. It's not your, he said, it's not your 80-year-old grandpa who's going out to the bars and clubs on New Year's. It's those in their 20s who then go see their grandpa and their grandma and their loved ones in the following days, spread the illness to them, and then those are the individuals who, again, are in that most at-risk group who will then have to go seek treatment at the hospital. So it's because of that he thinks that this ripple effect is going to continue for probably the next week, if not couple of weeks, when they really start to see those people right now, currently, who are waking up, starting to feel the sniffles for the first time, and then are going to progressively get worse over the next coming days to the point where then they have to go into the hospital.
So with that in mind, do doctors think we've hit peak yet?
He was kind of hesitant to talk about it a little bit. You know, I think there's probably a superstition among doctors to never say that until you're over the hump. The good news, though, he says that in terms of pediatric cases, it does kind of seem like those are waning slightly. Again, it could still be too early to really definitively say that. We are in the peak of respiratory virus season. So all three are still high, especially flu. Have to keep our eye on that over the next week, 2 weeks, and the state data as well. So I don't really know that we can for sure say that we have crossed that bridge yet.
Is it too late for people to get their flu or COVID shot if they're looking at these numbers and saying, oh man, I didn't get around to it in the fall. I maybe need to look into how I can prevent getting sick now?
Yeah, no, I think it's never too late, especially with, your flu and COVID boosters. They're always being updated and trying to target the most common strains that are out. So just because you're sitting there thinking, oh no, I didn't get around to doing it earlier, you should absolutely still take advantage of the walk-in appointments, schedule an appointment early if you would like to do that, and go ahead and get it. Because again, if what Dr. Wolf and all these hospitals are seeing pans out, it does seem like we're in store for this for the next couple of weeks. So why not do what you can now to protect yourself and your loved ones?
And what are some other ways that people can protect themselves or others from being sick if they're going back into the office and maybe concerned about coworkers bringing something back?
As we saw with COVID in the early days, masking is always beneficial to reducing the spread, kind of distancing yourself. If you have the option to work remote, why not look into that? If you woke up one morning kind of feeling a little congested, sniffling, why not do that? Dr. Wolf also said with this week, kids going back to school in Wake County, for example, if you're a parent, your child, as we know, especially younger kids, are not always the best at telling us when they are sick. They, will just kind of rub their nose a lot, sneeze, all of that, but they don't really understand that that means they shouldn't be around their friends. They want to go back to school. They want to be around their friends. They want to say hi to their teachers. But if you're noticing that your little one is sick, he definitely recommends keeping them home. Obviously easier said than done sometimes for working parents, but looking into the options that you do have, he also recommended if you really can't keep them home from school entirely, maybe you can drive them to school instead of letting them be around the bus with kids of all different age groups and really trying to reduce the amount of exposure they do have to others. Because again, as he mentioned, we kind of all do have this responsibility to each other to help mitigate the spread.
All right. Well, thank you so much for all this great information, Grace, and for joining me as well. And thank you for listening to the WRAL Daily Download. If you've listened to this podcast on WRAL or the WRAL News app, you can always find it in Apple Podcasts, Spotify, or anywhere you listen to podcasts. Follow the show so you don't miss an episode. Thank you for listening.